You've been told your entire life that the greatest threat to your health as you age is your heart, that a heart attack is what you should fear most. And yes, heart disease is serious. But what if I told you that there's another system in your body, one you rarely think about, that begins to fail years before your heart ever shows symptoms? A system so vital that when it collapses, it doesn't just threaten your life. It threatens your independence, your ability to walk across a room, your capacity to live without help. And the most troubling part? Almost no one is checking it. I'm a professor of orthopedic medicine, and I've spent more than 3 decades working with patients who come to me after the damage is already done. After the falls, after the fractures, after they've lost the ability to stand from a chair without assistance. And what I've observed again and again is that the decline didn't start with their bones or their joints. It started with something deeper, something that connects every movement you make, every step you take, and every breath that fuels your body. Today, I want to talk to you about a system that medicine has underestimated for far too long. A system that, when it weakens, sets off a cascade of problems that look like aging but are actually preventable. Before we go further, I'd like to ask you something. If you're watching this, please leave a comment below and tell me your age and where you're watching from. I want to understand who's listening, because what I'm about to share applies to all of us, but it becomes critical after the age of 55. The system I'm referring to is your musculoskeletal system. Now, I know that sounds clinical, maybe even boring compared to the drama of a heart attack, but hear me out. Your musculoskeletal system is not just your bones and joints. It's the entire network of muscles, tendons, ligaments, and connective tissues that hold you upright, allow you to move, and support the function of nearly every other organ in your body. And here's what most people don't realize. This system begins to deteriorate silently, steadily, and significantly starting in your 40s and 50s. By the time you're in your 60s and 70s, the loss is profound. And yet, when you go to your annual checkup, no one is measuring it. Let me explain what I mean by collapse. When I use that word, I'm not talking about a single catastrophic event. I'm talking about a slow progressive weakening that robs you of strength, balance, and mobility. It begins with something called sarcopenia, which is the medical term for age-related muscle loss. Starting around age 30, you lose about 3 to 5% of your muscle mass per decade. But after 50, that rate accelerates. Research published in journals like the Journal of Cachexia, Sarcopenia, and Muscle in recent years has shown that adults over 60 can lose up to 15% of their muscle mass per decade if they're inactive. 15%. That's not a small number. That's the difference between walking confidently and shuffling cautiously, between standing from a chair and needing someone to pull you up. But it's not just about muscle. Your tendons become less elastic. Your ligaments lose their tension. Your bones, especially in women after menopause, begin to thin. The cartilage in your joints wears down. And all of this happens quietly. There's no pain at first. No alarm bells. You just notice one day that you're a little slower, a little stiffer, a little less steady. And you think, well, that's just getting older. But it's not. It's the collapse of a system that was never given the support it needed. Now, why does this matter more than your heart? Because your musculoskeletal system is what allows you to remain independent. It's what lets you walk to the mailbox, climb stairs, get in and out of the car, play with your grandchildren. When this system fails, even if your heart is strong, even if your mind is sharp, you lose your autonomy. You become dependent on others. And I've seen this break people in ways that heart disease doesn't. Because a heart attack is an event, it's acute, it's treated. But the slow loss of mobility, that feels like a theft of identity. Let me tell you what we see in clinical practice that most people never hear about. We see patients in their 70s who fall, a simple fall. Maybe they trip on a rug or miss a step. They fracture a hip. And here's the reality. Studies from institutions like Johns Hopkins and the University of Michigan have shown that nearly 30% of older adults who fracture a hip will die within 1 year, not from the fracture itself, but from the complications, the immobility, the pneumonia, the blood clots, the rapid decline that follows when someone who was walking suddenly can't. And what caused that fall? Not bad luck, weak muscles, poor balance, a musculoskeletal system that had been quietly failing for years. Contrast this with what you're told at your checkup. Your doctor checks your blood pressure, listens to your heart, orders blood work. Maybe a cholesterol panel. All important, yes, but when was the last time someone tested your grip strength? Your ability to stand from a chair 5 times without using your hands? Your walking speed? These are called functional measures, and they're some of the most powerful predictors of longevity and independence. A study published in the BMJ in 2022 found that walking speed alone is a better predictor of life expectancy in older adults than almost any other single measure. And yet, it's rarely assessed. Why is that? It's not because doctors don't care. It's because our medical system is built to treat disease, not to preserve function. We wait until something breaks, and then we fix it. We're reactive, not proactive. And when it comes to the musculoskeletal system, by the time you're reacting, you've already lost years of strength and stability that are incredibly hard to regain. Now, I want to talk about circulation, because this is where the connection to heart health becomes clear. Your muscles are not just for movement, they're metabolic organs. When you contract a muscle, when you use it, it pulls glucose out of your bloodstream. It improves insulin sensitivity. It supports healthy blood flow. In fact, your leg muscles act as a secondary pump for your circulatory system, helping to push blood back up to your heart. This is why people who are bedridden or immobile for long periods develop circulation problems, swelling, even clots. Your muscles are part of the infrastructure that keeps your cardiovascular system functioning properly. So when your muscles weaken, your circulation suffers. Your heart has to work harder. Your risk of metabolic problems like diabetes increases. Your blood pressure can become harder to control. And here's the part that surprises families. We see patients whose cardiovascular numbers start to improve not when they change their medication, but when they start moving again, when they rebuild some of that lost muscle. Because the systems are connected, you can't isolate one from the other. I also want to address balance, because this is one of the earliest signs of musculoskeletal decline, and it's one of the most dangerous. Your balance depends on 3 things: your vision, your inner ear, and something called proprioception, which is your body's ability to sense where it is in space. Proprioception comes from sensors in your muscles, tendons, and joints. When those tissues weaken or degrade, your proprioception declines. You become less stable. You're more likely to stumble, to misjudge a step, to fall. And falls, as I mentioned, are catastrophic for older adults. They're the leading cause of injury-related death in people over 65. But here's what patients tell me years later, after they've worked to rebuild their strength and stability. They tell me they didn't realize how afraid they had become. afraid to walk on uneven ground, afraid to go out in winter, afraid to be alone in the house in case they fell and couldn't get up. That fear is insidious. It keeps you from moving, which makes you weaker, which makes you more afraid. It's a vicious cycle, and breaking that cycle requires rebuilding the physical foundation that gives you confidence. If you're finding this information valuable, I'd appreciate it if you'd take a moment to like this video and subscribe to the channel. I create content like this to share what I've learned over decades of practice, and your support helps me reach more people who need to hear it. Let me now talk about what you can do, because the purpose of this conversation is not to frighten you, it's to empower you. The good news, the truly hopeful news, is that your musculoskeletal system is remarkably responsive. Even if you've lost strength, even if you've been inactive for years, you can rebuild. It's not too late. Research from institutions like Tufts University and the National Institute on Aging has demonstrated that adults in their 70s, 80s, even 90s can gain muscle mass and strength through proper exercise. The body doesn't stop responding just because you're older. It just needs the right stimulus. So let me give you 5 actions, 5 movements that are simple, safe, and extraordinarily effective for protecting and strengthening this vital system. These are things you can do at home without equipment, and they address the core elements of musculoskeletal health: strength, balance, and mobility. The first is the sit-to-stand exercise. This is exactly what it sounds like. You sit in a sturdy chair and you stand up without using your hands. Then you sit back down with control and you repeat. Why does this work? Because standing from a seated position requires strength in your quadriceps, your glutes, your core, and your hip stabilizers. These are the muscles that allow you to get out of bed, out of a car, off a toilet. If you can't do this movement confidently, your independence is at risk. Start with 5 repetitions. If you need to use your hands at first, that's fine. Over time, try to rely on them less. The goal is to build the strength so that standing becomes easy again. Physiologically, this exercise is teaching your muscles to fire in coordination, and it's loading your bones in a way that helps maintain their density. The second action is heel-to-toe walking. This is sometimes called tandem walking. You walk in a straight line, placing the heel of one foot directly in front of the toes of the other, as if you're walking on a tightrope. This is a balance exercise, and it's one of the best ways to train your proprioception and strengthen the small, stabilizing muscles in your ankles and hips. Do this for 20 steps, preferably in a hallway where you can touch the wall if needed. What you're doing is challenging your body's balance systems, forcing them to adapt and improve. In real life, this translates to steadier walking, better reaction time when you stumble, and greater confidence on uneven surfaces. The third movement is the calf raise. Stand behind a chair or counter for support. Rise up onto the balls of your feet, lifting your heels off the ground, then lower back down with control. Your calves are critical for circulation. They're part of that secondary pump I mentioned earlier. When you strengthen your calves, you improve blood flow from your legs back to your heart. You also strengthen the muscles and tendons around your ankles, which are essential for balance and walking. Aim for 10 to 15 repetitions. You should feel a gentle burn in the back of your lower legs. That's the muscle working, adapting, getting stronger. The fourth action is the wall push-up. Stand facing a wall, place your hands flat against it at shoulder height, and step back so your body is at a slight angle. Bend your elbows and bring your chest toward the wall. then push back to the starting position. This is an upper body strengthening exercise, and it's important because your arms, shoulders, and chest are what allow you to catch yourself if you trip, to push yourself up if you fall, to carry groceries, to open doors. Upper body strength is often neglected in older adults, especially women, and that's a mistake. This movement is also building bone density in your wrists and arms, which are common fracture sites. Start with 10 repetitions and increase as you're able. The fifth and final action is single leg standing. This is deceptively simple but profoundly effective. Stand next to a counter or sturdy surface. Lift one foot off the ground just an inch or two and hold that position. Your goal is to stand on one leg for 30 seconds without holding on. If you need to touch the counter for balance at first, that's okay. This exercise is one of the best assessments and trainers of balance. It activates all the stabilizing muscles in your standing leg, from your ankle up through your hip and core. It also trains your brain to coordinate those muscles. In practical terms, this is what allows you to step over an obstacle, to shift your weight safely, to recover if you start to fall. Do this on both legs every day, if possible. Now, why do these specific actions work? Because they mimic the movements of daily life. They're functional. They train your body to do the things you actually need to do, and they don't require you to go to a gym or buy equipment or risk injury with heavy weights. They're low impact, scalable, and safe. But the key is consistency. Doing these 5 movements once won't change anything. Doing them 3 times a week for 3 months will change everything. What I've observed over decades is that the patients who maintain their independence into their 80s and 90s are not necessarily the ones with the best genetics or the most money or the healthiest diets, though those things help. They're the ones who kept moving, who stayed strong, who didn't accept decline as inevitable. And the patients who lost their independence, who ended up in assisted living or dependent on family, very often could trace the turning point back to a fall, an injury, a period of inactivity that they never recovered from. I don't say this to scare you. I say it because I want you to understand what's at stake. Your ability to live independently, to maintain your dignity, to enjoy your later years is directly tied to the strength and function of your musculoskeletal system. And the time to act is now. Not after a fall, not after a diagnosis. Now. Let me also address something important. Pain. Many older adults live with chronic pain, often in the knees, hips, or back, and they assume that exercise will make it worse. But what we've found, and this is supported by research in journals like Osteoarthritis and Cartilage and the Journal of Orthopedic Research, is that appropriate movement, the kind of gentle strengthening I've described, actually reduces pain over time. Because when you strengthen the muscles around a joint, you take pressure off the joint itself. You improve alignment, you increase blood flow, which brings nutrients and removes waste products. Movement is medicine. Inactivity is often what perpetuates the pain. Of course, if you have a specific injury or condition, you should consult with a healthcare provider before starting any new exercise. But for most people, the movements I've described are safe and beneficial. Start slowly. Listen to your body. Progress gradually. The goal is not to become an athlete. The goal is to be strong enough to live the life you want. I want to close with a thought that I share with my patients. Aging is inevitable. Decline is not. You have more control over your physical future than you've been led to believe. Yes, your body changes with age. Yes, you will lose some capacity. But the rate and extent of that loss is largely within your influence. The choices you make today, the movements you do, the strength you build, these are investments in your future self. They're the difference between spending your 70s traveling, gardening, playing with grandchildren, or spending them in a chair, unable to move without help. I've had patients in their 80s who have reversed years of decline, who have gone from using a walker to walking independently, who have rebuilt strength they thought was gone forever. It's not magic, it's physiology. Your muscles respond to stimulus at any age. Your bones respond to load. Your balance responds to practice. You are not broken. You are not beyond help. You are simply in need of the right information and the willingness to act on it. So here's my question for you, and I'd love to hear your answer in the comments. What's one thing you've noticed about your body in the last few years that made you realize you're not as strong or steady as you used to be? And what are you willing to do about it? Share your thoughts below. This is a conversation, and I learn as much from you as I hope you learn from me. Thank you for watching. Thank you for taking your health seriously. And remember, the most powerful tool you have is not a medication or a procedure. It's your own body's ability to adapt and strengthen. Use it, protect it, and give yourself the gift of independence for as long as possible.